For this occupational therapy portfolio, I'm going to be showing you how to do palpation. So first we're going to do the supinator. So Olivia, this is your supinator. It runs from here to here. And what it does is it rotates your palm up toward the sky. So what's going to happen is I'm going to hold your hand like this. And while you try to turn your palm up toward the sky, I'm going to apply some resistance so that I can feel your muscle working, okay?
Okay.
Go ahead. Okay, and that's the supinator. Now we're going to do a palpation of the pronator teres. So I'm going to hold your hand like this again. Your pronator teres is here. It runs from here across your arm to here. And what it does is it pulls your palm down toward the floor, opposite of the supinator. So again, I'm going to feel, and as you try to turn your palm down toward the floor, I'm going to apply some resistance so that I can feel your pronator teres working, okay?
Okay.
Go ahead. Okay, and that's the pronator teres. Now I'm going to do palpation of the biceps. So this is your biceps. It runs from up here to down here. And what the biceps does is it helps to flex your elbow. So what I'm going to do is I'm going to apply some resistance as you try to flex your elbow. And I'm going to feel to make sure that muscle's working. Okay, and that was the biceps. Now I'm going to do palpation of the wrist and finger flexors. So your flexor group is on the front side of your forearm here, and our identifying landmarks that our flexors are going to lie between is our brachioradialis muscle that runs here and your ulnar bone that runs here. So first, to feel the group working together, I'm going to have you make a fist, and then I'm going to have you pull your fist up toward your face. Okay, and I can feel that whole group working together. Now, if I wanted to isolate any of the flexor muscles, the first flexor muscle that I can isolate in the superficial group is going to be the flexor carpi radialis, which runs from here to here. And the way that I'm going to do that is I'm going to feel just right here, and what I'll have you do is I'm going to have you go ahead and release your fist, and what you're going to do is you're going to move your hand to here, okay, and again I can feel that down at the tendon and follow it up to the muscle belly as well to feel that one working. Okay, and the next one that I can isolate is the palmaris longus, which is going to run from the same spot up here, but instead we're going to go down to the middle of the hand here. And the way I'm going to feel this one work is by having you act like you're gripping a basketball. There we go. So I can see that one and feel that one as well. You can also follow that one to the muscle belly. Fantastic. Okay, and the last superficial muscle that I can isolate is the flexor carpi ulnaris, which is going to run from here to here. So similar to the radialis, we're going to do the opposite for the ulnaris, and I can feel that one working. Okay, fantastic. Now if I wanted to feel the deeper flexor muscles, there's a groove over here next to the ulna that I can walk my fingers in and up to dig my fingers under there a little bit. And what I'm going to have you do is move your fingers as if you're typing on a keyboard. And I can feel and see those ones working. So this is the palpation of the wrist and finger flexors. Now I'm going to do palpation of the wrist and finger extensor group. So your extensor group is on the opposite side of your flexor group. So your flexor group was here on the front of your arm, and your extensor group is here on the back of your arm. Again, the landmarks it's going to lie between is your brachioradialis, which runs here, and your ulnar bone, which runs down here. So if I want to feel all of these muscles activating together, I'm just going to feel this part of your arm here, and what I want you to do is bring your wrist into extension here, and I can feel all of these muscles activating together. Okay, so if I wanted to isolate these muscles, the first ones that I would feel would be the extensor carpi radialis longus and brevis, which lie right next to the brachioradialis. So for this one, what I'm going to do is I'm going to have you try to bring your fist up to your face, and I can already feel those ones working. And there we go. Again, so your extensor carpi, radialis, longus, and brevis run from here down to here, just before your carpal bones. And the next one I'm going to do after that is your extensor digitorum muscle, which is just next to the longus and brevis of the extensor carpi radialis. So what I'm going to have you do is I'm going to have you move your fingers as if you're typing on a keyboard. And not only can I feel it, but I can also see it moving in her arm here as well. Okay, and the last one that I'm going to isolate is the extensor carpi ulnaris, which again we're going to run from this spot down to here. And for this one, I'm going to go right next to the ulnar bone here, just right above it here, and I'm going to have you drop your wrist, and I can feel the extensor carpi ulnaris. So this was palpation of the wrist and finger extensors. Now I'm going to be palpating the supraspinatus muscle. So your supraspinatus muscle is up here at the top of your shoulder, right above this bone here called the spine of your scapula. It runs from here to here. And so what the supraspinatus does is it brings your arm out to the side for abduction. And what I'm going to do is place my fingers right here on the muscle. And when I tell you to go, I'm going to have you abduct your arm, bringing it out to the side. And I'm going to apply some resistance so I can feel that muscle contracting, okay? Okay. And go. All right, there it is. I can feel it contracting. Fantastic. So this is the supraspinatus. Now we're going to do palpation of the infraspinatus. So for the infraspinatus, I'm going to find the medial border of your scapula here, and I'm going to find the spine of your scapula and the lateral border of your scapula. And your infraspinatus lies right underneath the spine of your scapula, in between the medial border and the lateral border. And so it starts here, and it comes over here to attach on your humerus, which is your upper arm bone here. And so what I'm going to do is when I tell you to go, I'm going to have you lift your elbow up toward the ceiling, and I'm going to apply some resistance so that I can feel that muscle contract. Okay? Okay. Go ahead. And there's the infraspinatus muscle. Now we're going to do palpation of the teres minor. So the first thing that I want to find is the lateral border of the scapula, specifically the superior half. And once I am on that, I want to drop my fingers off the side of the lateral border to land on the belly of the teres minor. And so once I have some fingers up on the top surface of the teres minor, I'm actually going to stick my thumb down in the axilla to the underneath side of the teres minor, kind of grabbing it the way I would a sandwich. And once I have my fingers there, I want you to go ahead and bring your hand up toward your head, and I'm going to apply some resistance here, and I can feel that teres minor working. Go ahead and relax. Another way that you can get the teres minor to activate is to have them lift their elbow up toward the ceiling, just like that. Fantastic. The way that you would for the infraspinatus as well. Go ahead and relax. So that's palpation of the teres minor. Now I'm going to show you two different palpation methods for palpating the subscapularis. So I have my patient side lying with their top arm laying over top of them in flexion, reaching forward. So what I'm going to do with this hand is I'm going to try to pull this arm as forward as possible, while with this hand and this thumb finding the lateral border of the scapula. And once I find the lateral border of the scapula, it's best to try to go underneath the latissimus dorsi and teres major muscles instead of going through them, to get my thumb on the anterior surface of the scapula, which is the subscapular fossa. And then once I have my thumb on there, what I want to ask my patient to do is go ahead and immediately rotate your shoulder. There we go. And I can feel that that subscapularis muscle activate. Now I'm going to show you method 2 of palpating the subscapularis. So this time I have my patient in a supine position. And again, the subscapularis runs completely from the medial border of the subscapular fossa, which is the anterior surface of the scapula, and comes and attaches on the humerus. So what I'm going to do is I'm going to cradle my patient's arm in a flexed position. And I'm going to take the thumb of this hand, find the lateral border of the scapula, and I can easily place my thumb in there on the subscapular fossa. Go ahead and medially rotate, and I can feel that muscle contracting. So this is 2 methods of palpation of the subscapularis muscle.